Go.
Okay, do it.
There you go. Good.
All
All
right.
right.
So 64, in planning care for a patient experiencing a somatization disorder, which would the nurse define as an appropriate outcome? Peyton, what did you say that was again? Like physical?
Uh, that's like more psychological symptoms.
Oh, I'm sorry. Okay. Um,
Like they don't like. There's no. I don't know. Is it physical symptoms? Oh God. Hold up. Let me look it up.
I think it is physical
Is it
symptoms.
physical?
yeah, I thought
Yeah, I thought it
so.
was. I honestly can't remember.
So I saw some things that say, cognitive therapy is helpful. Gradually limiting focus on the physical symptoms is also helpful. Um,
No, you guys are right. Yeah.
set limits on, attention seeking behaviors. Those are all the things that I found.
Which
I would say it's B because
Yeah, I would also say it's
Okay.
Bravo.
somatic symptom disorders where a person feels significantly distressed about physical symptoms.
Okay, there you go.
Okay.
Okay, so Bravo.
Bravo.
Yeah.
Okay.
Okay. A client has a dissociative identity disorder for a long time, for as long as we can remember. Where does the nurse anticipate that treatment for DID will most likely occur? And I would say individual, right?
Yeah. I mean, that's what comes to mind. I mean,
Yeah.
this isn't really a good example, but like I've seen movies where like people who have
Split,
dissociative
remember that
yeah,
movie?
you know what I'm talking about?
I watched that
Yeah, no,
literally
Yeah.
last week.
So that's why I get like I think individual.
okay. I'm good with that.
But I'm
I
it's
don't
not the
know.
best example, honestly.
It's a good movie.
It was a good movie.
I like that one.
So, you guys want to do Bravo?
Okay.
Yeah,
I
but
think so.
all right.
All right, 66. Someone.
A client underwent a, is it radical, whatever,
Radical, yeah.
yeah, mastectomy, and as part of her discharge plan is encouraged to attend a breast cancer support group. The client asks, I know the biological theories for why people get cancer, but is there any proof that I'm blanking on this word.
Psychological.
Psychological factors play a role. Which of the following is the nurse's best response? Sorry, my dyslexia came out there.
It's okay. Um,
It's not Delta. Could be Charlie.
yeah, it could be. That's true.
Definitely not Bravo.
Definitely not A.
Yeah, I thought we discussed something about chronic stress can like weaken the immune system over time
Mhm.
I,
in like pathoform.
My guess is Charlie.
yeah, me too. Paolo?
Sorry, I'm saving the. Okay.
Oh no, you're fine. Save it.
Oh yeah, Charlie.
Okay.
Yeah, Charlie. Definitely.
For
Okay.
67, I would say PTSD for the soldier. Sorry, I read ahead.
No,
No,
you're
you're fine.
I think the same thing.
Yeah, I
Yeah,
agree.
because the Middle East convoy IED kills 3 fellow soldiers. Now,
Right.
she's reporting intrusive thoughts, screaming,
Yeah.
loud sounds trigger.
68. A client with antisocial personality disorder comes to the nurse's station at 11 p.m. requesting to phone a lawyer to discuss filing for a divorce. The unit rule states that no phone calls are permitted after 10 p.m. Which of the following nursing response is the most appropriate? Delta
I was thinking that too.
or A?
Uh, it's after 10 o'clock. You can call tomorrow.
Someone said go ahead and use the
Yeah,
phone.
I feel like
I
it's
know.
D, right? Delta, like you have to be like the rules are rules.
Yeah.
Right.
Like
But if they
they
have
can
an
call
yeah,
tomorrow
and they
and
have an
discuss it.
antisocial personality disorder, they could possibly lash out, you know, they need to follow the rules just like everyone else. And because of this, like they might like I don't know.
So,
Like they might
No,
try and like keep breaking the rules,
no, I agree. Like,
you
I
know?
feel like it's important to like reiterate the rules.
you
I'd say
Delta.
okay,
I agree.
all right.
All right.
69. Which approach by the nurse would be best maintain a therapeutic relationship with a client who has borderline personality disorder?
A,
Yeah.
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 very consistent but understanding.
Mm-hmm.
Yeah. Definitely.
All right, 70. Which nursing intervention is appropriate to assist a client with borderline personality disorder to extinguish clinging and splitting behaviors? Okay, definitely not A. Not B.
Oh, that sounds good.
Yeah.
Makes sense to me.
Mm-hmm.
Like they're not gonna follow a verbal contract and yeah. Delta.
Delta.
All right.
Delta.
Peyton.
Sure. I honestly don't know.
Well, what do you think?
I agree. I'd go Delta. It sounds the best out of those four.
Yeah. Because you don't want to ignore them.
No,
Um,
you don't want to restrict them,
yeah, you can't restrict them. And I don't think that a verbal contract is binding.
especially if they're having splitting behaviors. Like one of the
Yeah,
other,
it's
like,
just not, you know.
personalities. I don't want to say personalities, but like one of the other, identities could
Yeah,
come out
yeah.
and just disregard it.
Yeah. Oh, you were talking to that was a yeah.
Split. Back to split.
Oh, the other
That was
buddy.
That
Patricia.
happened. Yeah.
Or Hedwig, whatever the
Yeah.
Mhm.
All
I
right.
like the little
watch
boys.
that movie instead
We
of
should remember
Yep.
to
short
avoid
12 term.
All right, 71. When working with an older adult, the nurse should remember to avoid.
shifting from subject to subject, right?
Yeah, it'll confuse them.
Or is it?
All right. Everyone good with that?
Yeah.
All right, 72. A client is brought into the emergency department after being violently raped. Which nursing action is appropriate?
Remain non-judgmental.
Bravo.
Yeah,
Yeah, that
yeah, because you don't want to like have them, think of everything just yet. They're gonna have to do that when and if they want to press charges. The police aren't always gonna come, depending on how old she is,
Bravo.
Yeah, bravo.
Oh.
All right,
College
seven.
student experienced sexual assault when out on a date. After several weeks of crisis intervention therapy, which client's statement would indicate to the nurse that the student is making progress?
I know
Helpful.
it's not my fault.
Yeah.
Yeah. All right, 74. An 11-year-old boy stays home from school to care for his siblings while his mother works because the family can't afford a babysitter. When asked about his parents, the child reluctantly reveals that he thinks his father does not like him very much because he calls him stupid, and he says he can't do anything right. This should be assessed as,
Emotional abuse?
yeah,
yeah.
Easy.
absolutely.
Easy.
All right, 75. Select all that apply.
When
Great.
planning care for a woman who has been abused, which factor should the nurse recognize?
Oh,
Several attempts, right?
A,
Yeah.
A.
yeah.
D, I would say. Maybe
Yes.
I think
Yeah.
B.
You think B?
Yeah. A lot of the time that they're drunk, they're belligerent, and then like some little thing sets them off.
4.
I mean, it can be common, but I mean, maybe not all the time.
I think 4 as well.
4, yeah,
That's,
4 for sure.
So
And
right,
economic factors, we talked about this the other day, they have a roof over their head and someone's caring for their child right now, but if they left, where would they go? What would they have?
Mhm.
so right now it's 1, 4, and 5.
Yeah.
All right.
Is it 5?
I have 1, 2, and 4.
1, 2, and 4.
I have 1, 4, and 5.
I just have 1 and 4.
I don't
Oh.
think the economic factors, it says rarely
Yeah, it
play.
says rarely play a
Oh,
role.
oh,
They
I
do
didn't
play
see
a
that.
role.
I'm so sorry.
Oh, you're all right.
I didn't know. I didn't see that. I'm
Alright,
sorry.
1,
That
2,
is a reason.
1, 2, and 4.
Substance abuse is a common factor in abusive
I
relationships.
know.
That's tough. Like, I don't
That's a pretty-
disagree.
I don't disagree, but
Is it a common factor?
it can. I think it can be. What?
I know that for survivors, it's very
Fantastic.
common to, or people who have, who are on the victims of domestic violence.
Well, you also have to think substance abuse can also just mean like alcohol.
Okay,
Yeah.
domestic violence may be linked to several individual factors, including less education, personality disorders, substance use, cultural attitudes, gender ideologies, low self-esteem, struggling with anger management, insecurity.
Oh,
I agree. Then 1, 2, 4.
1, 2, 4.
Okay.
1, 2, 4. All right, let's go back. So
Okay.
that's right.
Let's just go
Real
from
quick.
1.
Michelle, quick. You got
All
it.
right.
Well,
So
hold on. Can I just stop this video now?
I mean, you could. I mean, we're done, I guess.
yeah.
I'm not gonna change our answers. I mean, are we?
Well, there I didn't know
It
if there
doesn't
was one
matter.
we
You know
left
what? That's
blank.
That's fine.
There might have been one we left blank.
We have all of them.
No,
Okay.
we
Yes,
well
I will.
40. We didn't do 40, but we're gonna go through it. I mean, I didn't put anything for 40.
I didn't either.
That's
Oh,
fine.
yeah.
It's fine. Let's just go review. I mean, not review, but get the answers. Make sure we all
Okay.
have the same ones.
Let's just do 40 real quick, and then we can call it, because I know
Okay.
it's gonna take a while for you to upload Paulo. So we'll
Yeah,
Okay.
yeah.
40
Go
shorter.
ahead. Which one? Because I don't know the
All
answer.
right.
So 40, I put data because you guys were talking about data. It does seem like data, right?
Oh,
When you're charting that.
I had focus, but I didn't
It's-
know where we left it off.
I wasn't
I'm
sure if it was
silly.
focus or data. I definitely agree. It's not action, it's not response.
So data.
But is that because the
I think it
focus
could be
charting is
data.
different than like normal charting? I thought.
Oh, you're probably
Okay.
right. I don't know. I don't even know.
I thought it was focused because
So focus charting, nursing documentation system that offers an efficient and organized approach to recording patient information and care. By prioritizing clear communication among healthcare professionals, this tool promotes enhanced collaboration, leading to better patient care outcomes.
So that didn't help.
So data, action, and focus, data, action, and response. So focus, pain, data, vital signs, or blah, 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 lab results, or blah, 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 action, interventions, therapies, other activities, blah, 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 response, improvement in pain, reduced after 30 minutes, deterioration, no change, blah, blah, blah. Focus is fever, data, vital signs.
I think it
So,
is data.
I think it is data.
Only because
it's
the
part of
focus
data.
is more like nursing interventions.
All right,
Yeah.
I'm going with data.
What do you think, Sydney?
75. Come on.
I think it's alpha.
It's alpha.
Okay.
Yeah, thank
All
you.
right.
All right.
All
that's
right, we're
it.
good?
Make sure we all have the
Yep.
same answers.
All right, here we go. I'll go over them.
You want to end the?
Got it? Or you want
Yeah,
me to
let me end
Will
this.
you end the
through
recording?
this?
Yeah.
I'm gonna
This way
stop.
we